Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of The Golden Hour. I am your host, Dr. O, and today I am joined by Sara Reardon. Dr. Sara Reardon has been caring for people's pelvic floors and as a board-certified pelvic floor physical therapist. She is a graduate of Washington University in St. Louis with a bachelor's of arts and doctorate of physical therapy. She's the founder of The V-Hive, an online pelvic floor workout platform for pregnancy, postpartum, menopause, painful sex, and pelvic floor strengthening. As the Vagina Whisperer on Instagram and TikTok, she has over 700,000 followers. Sara lives in New Orleans, Louisiana, and her first book, Floored, A Woman's Guide to Pelvic Floor Health at Every Stage, Age in Every Stage, is being released June 10, 2025. Welcome, Sara.
Thanks, Dr. O, for having me.
Oh my gosh, it's an absolute honor. I found myself like tripping over my words during your intro, mainly because you just do so much. Like I was listing all the different ways that you help with the pelvic floor. I'm like, oh no, the list, it's still going. It's still going. It's still going. Oh, and she has an online platform and she wrote a book. So it's always fun for me being able to do those intros because I already have a glimpse of the person I have the honor of interviewing, but when you actually read those things on paper, it's so impressive. So thank you for making the time to join me today.
Absolutely. It's so interesting because, I've been in this field for 18 years and it still feels like the blink of an eye, but at the same time, I feel like a dinosaur because I've been doing this for so long, but it's really been an incredible journey from graduating PT school and specializing in pelvic floor health to now, as you mentioned, having, a larger presence and really just helping and hoping to move the needle forward for pelvic health care for women. Yeah. So it's an exciting time.
Yeah. Well, that's a perfect segue. I would love to hear about your own personal journey of why pelvic physical therapy, why pelvic health. I think for me as an OB, it comes up time and time again, not only pregnancy, postpartum, but as you mentioned, dyspareunia, which is pain with sex, menopause, and those pelvic floor changes due to the decrease of estrogen and everything in between. And so some of my work besties, if you will, are the pelvic PT, like my favorite referrals to make. My sister actually is a urologist who did a pelvic reconstruction fellowship. So I know it really well thanks to my sister, but I have a true appreciation for those of you who choose to focus on the pelvic floor, because when our pelvic floor isn't acting right, it affects us in so many ways, right? My sister literally described it as the workhorse of the body. It helps us with our posture, our walking, how we stand, how we sit, everything in between. And I think it gets taken for granted, right? And it's not until it starts acting up that we really are like, oh, what's happening here? So inevitably, I think most women will be affected by the pelvic floor changes in some way, even if you don't conceive, whether it's in menopause. And so I think what you do is such a gift. But yeah, why do you do what you do? What led you down the path of pelvic floor?
So I went to physical therapy school thinking that I was going to be a sports physical therapist. I loved running. I had done sports in high school and just for fitness. But however, I think it was in my second year of physical therapy school, I have a professor who's still my mentor to this day, who gave a 2-week lecture on what was then called women's health, is now called pelvic health. And it really just explained how this group of muscles called the pelvic floor muscles helped with everything you just described, everything from core support to exercise, to breathing, to, bowel movements, urination, birth. And I'm thinking, oh my gosh, I've never heard of these muscles before. And I felt like it really helped me understand my own body as a woman. And then when I started practicing in this field, I did a clinical rotation at the University of Michigan in Ann Arbor. And I loved working with the patients and helping them understand their own bodies.
Yeah.
And I jumped right into this field immediately after graduating PT school, and it's all I've ever done. And it's so interesting because I'm also a person who likes to know a lot about one area. Yeah. And so for me, doing just pelvic floor health, and I've done this for all genders, for males, females, and over the years, and it's just really been outstanding to help people improve their quality of life with really intimate, often embarrassing issues that they've never talked to anybody about. and they didn't even know
Yeah.
there was help for. And it just impacts their life so greatly. And then to help them reach their goals and overcome that is so rewarding. So I feel like I selfishly love this field because it helps me feel good about the way that people are really transforming their life.
So well said. No, you're right. There are so many things that we learn in like general education. I have my own thoughts that like reproductive health isn't taught well enough and sexual health, but I remember my first real exposure to the pelvic floor was in medical school in my anatomy lab, where we had these people who were so generous to donate their bodies for anatomy labs so that we can learn, and seeing all these muscles. Yes, the whole human body is amazing, but the pelvic floor, and I think at that point I knew I wanted to be an OB. So I was like, okay, Anna, you really need to like, you need to ace this section of your anatomy lab. But it was so impressive how this network of muscles like worked to help support our organs in a way that, in such that we don't normally feel our organs, right? Like I always like that workhorse of our pelvic, of our body. The pelvic floor makes it so that we otherwise feel pretty good when it's working well in conjunction. I remember being so impressed by all those pelvic muscles, and names that I've gratefully, now they've taken a bunch of tests, like they're out of my head, but I know you know them. So I'm so grateful that you still know all of them. But yeah, just being so impressed and finding that section of my anatomy lab really hard, because it is really complex. And so I appreciate you becoming a specialist in just that muscle group alone. I think those who are not in medicine might not be able to appreciate like the complexity that is the pelvic floor and why it does deserve its own field. Can, for the general audience who I know are not pelvic PTs or OB docs or those who are medical health professionals, can you describe the pelvic floor and how it changes in pregnancy and postpartum?
Absolutely. So your pelvic floor is a group of muscles and they sit at the bottom of your bony pelvis. So if you think about that skeleton model that we have seen in doctors' offices or even on little jammies of kids, and it's those kind of elephant ear shaped bones, or if we put our hands on our hips, that's the top of our pelvis. So that basket of muscles sits at the bottom and it attaches from the pubic bone in the front to the tailbone in the back and side to side. And it rests like a hammock. In the female body, it supports the uterus, which holds a growing baby during pregnancy, the bladder, which holds urine, the bowels, which hold stool. In the male body, it supports the bladder and bowels, and then also the prostate. So, I think what's interesting is that as an OB, you kind of learned about these muscles, and I, learned about these muscles, but I learned across them of all of these different specialties of GI and colorectal function because of, the assistance with bowel movements, through, obstetrics and gynecology because of the role that they play in a vaginal birth, or sexual health or menstruation, urologists and urogynecologists because of their function with bowel movements. Also, just there are nerves and tissues that go to this area that are also kind of integrated into these muscles and tissues. So we're working with athletes and just really every walk of life. And I think what is kind of a common myth is that only pregnant women or postpartum women or aging women experience pelvic floor issues, when it can really affect you at every stage of life. And so in the book Floor that I'm releasing, it's really talks about how when you're first menstruating, like, what do you need to know about your pelvic floor health? How do hormones influence this? How do you insert a tampon properly? How normal should period pain be? And then walks you through sexual health and reproductive health. And I think the sex education we get as young women and young men, it's like sperm meets egg and then baby is born. And I'm like, it's so outdated and archaic, but
It's too basic.
nobody teaches you about your pelvic floor. That, I mean, grown adults don't even know they have 3 openings in these muscles for urination, bowel movement, and the vaginal opening. And so if we don't learn these things when we're young, we don't get the understanding of our bodies. And then over the course of life, as things change, again, you mentioned people take it for granted, but we've never been taught it even exists. And we often don't know it exists until there's a problem.
Yeah.
And that's kind of where pelvic floor therapy comes in, is we're often kind of pulled in after something's become an issue versus helping women preventatively learn and take care of their bodies in this part of their body.
Yeah. We'll definitely talk more about your book. And I think themes that your book brings up really excites me as an OB, because I recognize my privilege. I got to like nerd out for 4 years in medical school and then another 4 years in residency. And part of being a doctor and any clinician is being a lifelong learner. Like, I continue to challenge myself and learn about the broad field that is women's health and the different subjects within it. But you're right, most people, most normal people, even though they have an awareness of self, don't have awareness of each parts of their body. And every time a patient comes in to see me with a concern or a complaint, I recognize that oftentimes I'm just providing reassurance and education. And those are some of my favorite types of visits, where I'm talking to them and nothing is wrong. A common phrase I say that my patients have probably heard me say many times is, I don't pathologize the human body. I don't make problems of it. There are many normals of the human body, many variations of that normal. But sometimes you don't know you're normal. You don't know what that thing is that you're experiencing. And a good clinician like you and me are going to help educate that. And I love those moments when I can teach my young teenage patient about her vagina and her pelvic floor in a really helpful, empowering, and trusting way. But you also brought up something earlier about taboo, and that the fact that some people live in shame of the pathologies, of the symptoms that they have, whether it's urinary incontinence or discomfort with intercourse. And that's really hard too. What do you say about the taboo around pelvic health, and how do we make patients, clients feel empowered to seek people like you out, or go to an OB like me and ask for a referral?
I think, one of the common things you'll hear me say a lot is, I want to normalize pelvic floor conversations. I don't want to normalize pelvic floor problems. I think the narrative has been for women that, like, oh, if you have a vagina, like, you can leak, you can have pain, you can have dryness, you can have hemorrhoids, you can have prolapse, when we've kind of just brushed these issues off as, oh, you have a vagina, these things are going to happen, versus like, actually, can we do things to prevent them? Can we help make women more comfortable if they do experience them? Can we give them treatment options and information so they do feel empowered about their pelvic floor health? So, I think that the reality is probably over 50% of women will experience a pelvic floor issue at some point in their lifetime, and they don't know that that's not normal. They don't know that a little leak with coughing or sneezing could become more severe incontinence with aging, or they've been told that sex is bad, or, we have a lot of cultural and religious narratives about what sex means. And all of a sudden we're supposed to flip a switch and like, okay, now it's okay to have sex. And it's painful. Well, we've never talked about sex. So is it supposed to be painful? I thought this was normal for people.
Yeah.
So I think that there's just it really starts with a lack of education. And one of my biggest goals in my career, and also with this book, is that we just understand our bodies better so that we can change this for the next generation. I think if we don't know better, how do we teach the next generation what is normal, what is not, what we need to get help for, how to prevent issues? And so I think that that's really where I like to focus, is just really educating people, as you said. I mean, there's research to show that like 1 hour of pelvic health education can actually help somebody with their issues, because we've just never been taught about it. Like, how do you properly pee or poop or breathe during birth, or manage prolapse? That, all these things that so many people experience, but they're just thinking there's nothing that can be done.
Yeah. Yeah. I got chills hearing you describe that and describing your mission. Our missions are similar in that I think you and I both want to empower people. And I think that it's through empowerment that we feel secure and safe in our bodies. We have the courage to seek help when needed, and to understand how to support ourselves better. And so I'm grateful that people like you exist, that you have your vast resources like VHive and your book Floored, and your online presence to really create a space of normalizing our understanding of pelvic floor, and helping us shift from this like place of taboo and shame. Something that you mentioned earlier. Oh, go ahead.
Well, one of the things I was going to say is that another goal is that like people also feel very isolated and alone if they're having a pelvic floor problem. It can feel really embarrassing and they don't talk about it. And so I think one of the other things is like so many women experience these issues. I mean, there have been times in my career I see 40 patients a week and every single person is there because they have a pelvic floor problem. So I think knowing for women that for them to feel like, oh, I'm not alone in this. It's, not ideal. It is embarrassing, but it's actually like a lot of people have this, and so I think it can just kind of shed some of that shame. So we stop like just hiding this in our closets or in our bathrooms or in our bedrooms, that if we start talking about it, then we say like, this is an actual issue. And I'm not the only one that has it. And I think that helps us kind of drop our shoulders a little bit, take a deep breath, and start being able to seek support, because we can't advocate for things we don't even know are problems. And it's really hard to do when we think we're the only ones that are experiencing that.
Yeah. Oh, thank you. Thank you, Dr. Reardon. No, but it's because it's so true. I think this podcast was born out of a lot of different notions besides the idea of empowering patients and birthers and pregnant people and postpartum people and everyone in between was also that idea of community. There's so many times where I meet people one-on-one, and especially you, in such vulnerable moments in their lives where they feel so othered, they feel so lost, they feel like there's no way anyone else is experiencing this. And so I found myself having the same conversations again and again, and realizing, gosh, there is a role in creating a space to have these conversations on a larger context, that people realize, no, you're not the only one who's concerned about this. You're not the only one who's feeling this. Like, there are other people who are feeling this way. And what can we do, again, to have you walk away from a conversation feeling empowered and with the resources that you need to help yourself? So we're doing it. You and I together, Dr. Reardon, we're having the conversations I've always dreamed of having, and so, so grateful. Taking a couple steps back, you kind of mentioned, helping people understand, the pelvic floor changes to expect. I think you described really well, just like the generalities of the pelvic floor. But if you can give kind of top 3 pieces of advice for someone who, and I understand also that the patients that you care for is a large spectrum of women, men, non-pregnant, pregnant, but for, say, a pregnant person who's listening right now, what would be kind of expectations for pelvic floor changes in pregnancy?
So we know that the pelvic floor itself changes in pregnancy. So as I mentioned earlier, this basket of muscles is a hammock, and it supports your uterus, which supports a growing baby and growing fetus during pregnancy. So, we get these text messages or emails that are like, the baby's the size of an avocado, then it's the size of a papaya, then it's the size of a watermelon by week 40, if you get to that point. But if you think about a hammock supporting an avocado, it's not going to change that much. But if you think about a hammock supporting a watermelon, that watermelon's going to make that hammock drop down lower. It's going to stretch it out. It's going to have a harder time supporting that watermelon at a higher level. And that's what happens to your pelvic floor during pregnancy. So you're going to experience likely weakness, decreased support, urinary incontinence, low back pain are common symptoms. But I will say, during pregnancy is really a ripe opportunity to start proactively working on your pelvic floor, because we know these changes are happening. And the research is very clear. If you work on incontinence or prolapse or, pain during pregnancy, you're less likely to experience them postpartum. I think often we hear, oh, just wait until after you have the baby to deal with it. But if you are in pain or leaking, that can affect you for 6, 7, 8 months of your pregnancy. I'm like, 1, why should you have to suffer with this discomfort when there is support? And 2, you're going to have better outcomes after the baby's born if you address it sooner. And so I work a lot with pregnant moms on teaching them how to support their core, support their pelvic floor, modify exercises and movements during pregnancy. We work a lot in 3rd trimester on birth preparation. You can do this for a vaginal or cesarean birth, but also during a vaginal birth, really teaching them just options for positioning and breathing and pushing and comfort measures. And, I think a lot of the times, and I knew this for myself, when we walk into birth, we are automatically vulnerable. We are kind of handing over our care to trusted people like yourself and the nurses and everyone at the hospital, but it's our first rodeo. So, I think that the more that we know, sometimes it can help us feel more prepared versus scared. I think to me, walking into a situation where I know nothing feels scarier than like walking into like, okay, a lot of things could happen. Here are some of them. I feel like I at least am a little bit aware of what the options are. And I trust my medical providers to kind of to guide me through the best resources and options when those decisions come to mind. So I think that pregnancy is a really important time. I also am a huge fan of postpartum pelvic floor care. Ask all of my patients and recommend that they come back at 6 weeks postpartum after they see their OBGYNs. Like, you see your OBGYN and you're in the clinic the next day for pelvic floor assessment, because both C-section and vaginal birth moms have pelvic floor changes, abdominal wall changes, and you've been through one of the biggest physical transformations you're going to go through in your life, and your hormones are still fluctuating, and you might be lactating, and you're caring for a baby. And like, you need care. And I think that that's, again, another narrative that really needs to change is the support that we offer moms after birth as well.
Yeah. Oh, Sara, we can let's just chit chat for the next 10 hours. But no, it's true. Like, when you were going through your list of and, I was like, yes, because there's so much that happens after birth, and so much of this podcast, even this passion project, was born out of my frustration with a system that doesn't adequately support the massive transformation that happens physically, emotionally, mentally postpartum. And this concept of matrescence, where one of our biggest hormonal and physical shifts were adolescence, right? When we became those teenagers that really annoyed our parents because of the hormonal changes, our physical changes, etc. But matrescence is really this concept of that same drastic change that happens from pregnancy through postpartum. And to me, is a perfect way to encapsulate that massive epic transformation and everything that happens post delivery. That postpartum oftentimes is unfortunately kind of cued into like the 6-week period, but that's just because of like insurance coverage and how we check things in and et cetera. But you know more than anyone that those physical changes that happen in pregnancy and immediately postpartum can continue on and manifest in different ways. And so really got like so enthused to hear you kind of recognize how epic that transformation is and how much more we can do to support birthers through that postpartum transition. Something that you said that I really want to kind of dive deeper into is, yes, we know that the pelvic floor is going to change in pregnancy. And I love the analogy of like papaya to watermelon. As soon as you see the watermelon, like even as an OB, like I have for thousands of people, I know how physically demanding it is. I see it like day in, day out. But as soon as you said watermelon, I felt my pelvic floor going, oh, like that is heavy. We've all lifted up a watermelon in the grocery store. We all know what that is. Imagine that was pushing on your pelvis. But so I think what I really appreciate about you is this concept of like preventive health, being proactive, like anything that you can do in pregnancy can really help improve any potential symptoms postpartum, let alone that aging pelvic floor as we get older. And you mentioned different exercises that you might recommend to patients. What specific exercises would you say, like if you can narrow it down? Because so much of these conversations I'm having now too is recognizing that there's privilege and being able to afford being able to see someone like you or having an OB who has a referral source to pelvic PT like you. And so I want to have conversations for those who don't have that privilege to be able to hear us and say, okay, I feel empowered. I can do this. I can do this at home, or at least find maybe a YouTube channel to help walk me through it. But yeah, what are some of those exercises that you would recommend for preparation when you're pregnant?
So it's interesting because I will kind of walk through like what I think is important for the first couple trimesters. And this varies for who your physical therapist is and what your needs are and activity levels, and then also for birth preparation. So the reality of it is that if you were going to ask me, what is the number one thing you need to do during pregnancy? I would say walk, because it's free, right? We sit too long. We don't move enough. We need blood flow to our pelvis. We need to get outside and get fresh air. It lifts our mood. We sleep better. I mean, the benefits are endless, and it's free. And so I'm like, if there's nothing else, if you don't want to turn on a video or a YouTube, or you don't have space, I'm like, just get out and walk. Like do your 30 minutes 5 times a week, at least 3 times a week. Just move. Park at the end of the parking lot and walk towards the door. You know, however you can get steps in, I think is important. I also focus a lot on posture and breathing during pregnancy. So we can often find ourselves we maybe used to get out of bed, like doing a crunch up and kind of hiking up out of a chair or a bed and over tensing our core. But that core and abdominal wall is really stretched out during pregnancy, and we want to minimize the excess pressure on it. So I tell people to roll to their side, getting out of bed instead of crunching up. If they're going to get out of a chair, to scooch their butt to the edge. And I, kind of lean forward with their nose over toes to push up instead of using their abs to push up. These small changes, but they actually go a really long way if you think about how much you're getting out of bed multiple times a night to pee, or getting out of a chair and you're using your abs and overstretching them. Another tip is I call it exhale with exertion. So anytime you're exerting effort, whether it's picking up a box, moving furniture, lifting weights, you don't hold your breath, you breathe. Okay. And that's going to minimize the pressure down on your pelvic floor to minimize weakness and out towards your core. And then we're also all very familiar with a pelvic floor, or what we call a Kegel contraction. So a pelvic floor contraction is when you squeeze and tighten your pelvic floor to stop the flow of urine, to hold in gas. It kind of lifts that watermelon up, right? It supports that watermelon or that baby. And I tell people to pre-contract those muscles before they do an exercise. So before you squat, before you pick up a stroller, before you lift your toddler, like engage those muscles before you cough or sneeze to prevent leakage. Use those muscles when you need them. When we get closer into 3rd trimester, I'm a again, keep up your walking, but I really look more into yoga poses and breathing and things to quiet your sympathetic nervous system and also open your hips. So, lunges on a birth ball or child's pose or happy baby pose, things to really open those hips, stretch and release your pelvic floor muscles, because your pelvic floor muscles don't push your baby out during a vaginal birth.
Yeah.
I've actually watched childbirth education classes that are still currently being given. And the nurses say, like, you need really strong pelvic floor muscles to push that baby out. And I'm like, that's completely wrong. Your uterus pushes, uterus pushes your baby out. You need your pelvic floor muscles to relax and get out of the way. So we need relaxed, lengthened muscles so you can bulge properly. And I teach people how to bulge as if they're trying to poop. Like if you're sitting on the toilet and you can bear down and push like you're having a bowel movement, that's the same motion you need to do during birth. So it kind of changes depending on what stage of pregnancy you're in. But again, all of this to say there's so much you can do to really connect with this part of your body during pregnancy and birth.
Yeah. No, I love it. This has been really validating because whenever there's always that moment where a nurse will call me in saying, hey, Dr. Nseo, patient's fully dilated. And I have the honor of working with some great midwives as well. So that means I don't get to get into many normal deliveries myself these days. But when I do, my 3 pearls of pushing, right? Or it's all about opening up your pelvic floor as much as possible. So I talk about kind of curling around your baby's body or imagining, so like making a C shape with your spine, because that helps kind of change the contour of the lower half of the pelvis, opening up the pelvis depending on what your pushing position is in any way by moving the thighs back, etc. And my favorite one is push like you have to poop. I always tell patients, like, if you poop in here, honestly, it's really weird, but your OB, the midwife, the nurses will all be happy because we know you're pushing right. Like, it's so normal, and it's great to normalize that. Like, yeah, pushing like you have to poop. It doesn't sound really graceful, but it gets the job done.
It does get the job done. And honestly, when I felt my baby kind of crowning, I was like, it feels like I'm either about to have a baby or take the biggest poop of my life. And so, that's really what it feels like. And my patients are like, I'm afraid I'm going to fart or poop. And I'm like, don't be. Like, that means you're doing it right.
Exactly. No, really, like, it's really, I'm going to admit it, it's kind of gross, but like for me as an OB, if I walk into the room and like I smell something, like, great, she's pushing right, like everything is good. Like it's nature, man, right? Like that's part of like helping us make sure that people don't feel alone and othered and dismissing the shame, because it is so natural. Like where the baby is exiting vaginally is where our rectum is. So it all makes sense. Something that you alluded to, which I'm so curious about, is that, you've heard birth educators still teaching patients like about strengthening the pelvic floor and like making it really strong, because that's what's going to push back the baby. If anything, that's what's would inherently sometimes hold the baby back. What are other common myths and misconceptions that you hear out there about pelvic floor health and pelvic floor changes, pregnancy or postpartum?
I think one we mentioned earlier was that you don't need to see pelvic floor therapy until after the baby's born. And I think that one is it's a bit of gaslighting, because you don't know the level. You may think, oh, it's just a little bit of leakage, or, oh, it's a little bit of pain, but that could be severely debilitating for somebody, or prevent them from exercising, which we know is important for their mental health, or their lifestyle, or, I think it affects our self-esteem, our self-consciousness, our activity levels in ways that people don't realize. And it can feel very dismissive. So I think, and then some of the other ones are that, like we mentioned, like leakage is normal, pain is normal, prolapse is normal, abdominal wall separation is normal. Like there's nothing you can do. And that's not true at all. There's actually quite a bit that you can do to prevent it and also treat it. Like, I leaked on myself when I was laughing during pregnancy, but I'm also like, okay, I need to kind of work on my pelvic floor and kind of do some exercises and things like that. But, I think one of the biggest challenges we have now, and which is really tricky, is like preparing women for a vaginal birth, because I'm in Louisiana and our C-section rates are so high. And I think that a C-section is a very necessary medical intervention. And it's so awesome that it's available, because people need it. Women need it. Babies need it.
Yeah.
But I think that the rates are astoundingly high, and it's setting folks up to have future cesarean births. And I think that it can be, I just wonder, like, why is that continuing to move in a higher and higher direction?
Yeah.
When some of the, when you get an epidural change, your birth? Or does pushing on your back versus pushing on your side really affect how the baby can come out? Or is how you're breathing during birth really, is it more effective if you breathe, or is it more effective if you hold your breath? I think
Mm-hmm.
to me, what I see is hundreds of thousands of women birthing a year, and we're using one technique for all of them. And I
Mm.
really wish people had more options, and that we could work
Yeah.
alongside medical providers to say like, hey, what are the options? Because it often feels like they don't have options, which I think is one of the myths, is like, hey, there's one way to do it.
Mm.
When as a movement specialist, I'm like, oh my gosh, but like their pelvis is different, or maybe their baby's in a different position, or maybe they're tired and they need to be this. Like, I think that there's so many nuances to birth. And I feel like sometimes those aren't utilized as much, to think about maybe the baby is safe and the mom is safe. But like afterwards, I see so much pelvic floor dysfunction and almost trauma
Oh.
that I feel like, are we doing what's best for the mom sometimes when
Mm.
I see the aftermath and it feels
Yeah.
really traumatic for them?
Yeah. Oof.
I know it's a
Yeah.
lot, big one.
No, it's a lot. No, and I say oof because, I find that I went into medicine, and specifically the field of OBGYN, because I'm an empathetic person. I care deeply, and something that I reflect on time and time again are the amount of patients who will walk away from an experience and report feelings of trauma, right? Whether it was related to having an unexpected C-section, or maybe they did have a vaginal delivery, but they hemorrhaged after delivery, or maybe nothing happened with their vaginal delivery, but then 3 months postpartum, they're still having significant pelvic floor issues. And I mean, many iterations that become trauma for someone, and they wear that and they bring that into the next pregnancy, the pregnancy thereafter. And so I think there's so much onus of those of us who are in this highly vulnerable and delicate and beautiful space to work that much harder to lift up our patients and be that much more intentional and thoughtful. And so that was why my big sigh was, because I'm like, yes, I appreciate you bringing it up. And yeah, every state is different. I'm very, very fortunate. I'll recognize that with all my medical training was in California, and I practice in California. And California is one of the states with the lowest C-section rates, and it's intentional. It's based on policy, right? That our hospital, actually, they measure our C-section rates, and we are incentivized to have low C-section rates because of what you said, right? That whether or not that was a traumatic experience for that patient, we also know that inherently subsequent C-sections can lead to increased risk for future C-sections. And you're very right. Like, there are times where I work in a collaborative practice, which, for those who are listening, if they don't know what it is, it's midwives and doctors working together. And that's a beautiful system that I know that not all clinic settings are able to have, because collaborative practice allows the midwives who are experts in normal physiological birth do their thing, right? They are phenomenal at, working with a patient and seeing, hey, your labor is taking longer. Is it because your baby is sunny side up? Okay, let's try these different positions to help your baby rotate in your pelvis. Okay, you're pushing, and you're pushing well, but the baby's not descending well. Like, let's try these different positions, right? They are experts in it, and I will also acknowledge are more patient than me, but mainly experts in it. And so it's, if anyone has the ability to work with a practice that can offer midwifery, and I think it's excellent, because it also means that, as you said, sometimes C-sections are really necessary. And I fully appreciate I have this skill set that when the midwife tells me that something is happening and she's concerned, or there's something that really urgently happens and the nurse is calling me in, I can act quickly and I can assess and opt in to do a C-section if that's absolutely the right thing for the mom and the baby. But there are many, many, many women who I believe would benefit and be able to successfully have a vaginal delivery, when the team that's supporting them is motivated to do so, and that team is being creative, again, with the confines of keeping, we always say, mom and baby safe, right? You're never going to end up with a team that's going to say, well, the baby looks like they're in distress, but we're going to try a bunch of things. Of course not. I have to preface that, just in case people don't recognize that. Ideal is looking at that person as an individual, trying to figure out like what pushing technique works for them, like open glottis versus closed glottis, which is like, yeah, keeping your breath in versus releasing it. Like, everyone is different. If I'm in there pushing, even though I generally say like, okay, take a big breath, hold it, push, even though that's like what I know, but like someone is effectively moving their baby well and they're letting out the breath and they're practicing like open glottis, great, do it that way, right? Like, figuring out what works best for the person who's pushing. And so I appreciate what you're saying. And I hope that it's conversations like this that will continue to inspire providers in the maternal health space, if like they don't work in collaborative practice or they aren't working with a team of nurses who are offering patients different positions to push, and that they bring that back to their leaders to continue to work on, because that's what we owe to the patients who walk into that space with such vulnerability and trust. We owe that to them.
Yeah. And I mean, that's so beautiful the way that you say it. And I don't think that it's any medical provider's fault necessarily. I mean, this training has just not been, this kind of all folds back into one. There's such a lack of research in this area. We haven't been tracking, like I see the pelvic floor issues, right? So I don't see the folks that don't have problems. I see the people mostly who do. But I think that now we're kind of realizing like, oh, there's a sequela of issues that can affect someone's life later down the line. And because of some like things that have happened during birth, like, and so they don't feel, they either don't want to have babies or they feel like, so affected by their birth and their postpartum issues that they are kind of thinking like, what do I want to do? You know?
Yeah.
But I think that it's just the education hasn't been there. And so now we're seeing like, I mean, we have nurses and OBGYN practices and midwives reaching out to pelvic floor therapists like, hey, what do we need to know? And I think that that's the beauty of this is like, I love collaborative care. Like I would love for there to be a day where there are PTs like checking on mom's day one after C-sections, or, you know, in the, you know, labor units, you know, helping if they need to with position, like anything like that. It's just like, who's making up the teams to help the patient and all the medical staff, like really make these choices, because not everybody can know everything. And the training just varies across the board. So I think it's just one of those things of just the light bulbs going on of like, we have an awareness now of like, this needs to improve. And, but yeah, many times I've had patients who have had vaginal births and like, I just wish I would have had a C-section because I had this happen. I'm like, and I think we just want folks to know their options. And I think it's moving in a positive direction overall. Like, I think people are really recognizing that they want to have more autonomy over their body. They want to be involved in these choices and they want to understand what's going on. And I think that that's really exciting because that's how we can really like ask the questions and learn more and really make informed choices.
Yeah. I appreciate you saying that there's no fault to any provider. And if anything, I know what I know, right? Like I went to school and I learned tons, but I don't know what you know. And so it's so phenomenal to be able to practice in a community where I can refer patients to a pelvic PT. And I think one of the unexpected benefits of doing this podcast so far is every person I interview, like pelvic physical therapists like you, lactation specialists, mental health specialists, I walk away with something learned. Like you've already said several things in our episode so far that I'm like, oh my gosh, I can't wait to be able to share that with patients when I see them, right? Like I alluded to this earlier, but we're all lifelong learners and it's such an honor to continue to learn from one another. So thank you for acknowledging that and giving us the opportunity to learn from you today. So I'd like to take a moment to tell you this is my passion project based on years of experience as an OBGYN doctor. I aim to empower moms and moms-to-be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Now as we move, the OB in me, like I move through trimesters, I move through stage points in pregnancy. So now my mind is in the postpartum stage. So we talked about kind of, ways, different exercises that you can do in pregnancy to kind of help with the pelvic floor changes, incontinence, pelvic pain, and then prepping for childbirth. That it's postpartum where I likely make my most referrals, right? What are some of the kind of most common pelvic floor changes postpartum, and what are kind of common ways that you help support clients to address those?
So I think oftentimes after birth, we assume that folks are going to have pelvic floor weakness, which is very true. Like those muscles have been lengthened. They may have gone through a vaginal birth with a pushing stage for a long time. But I would say a lot of birthers also have tension. So it's almost like they have tension in their hips. Their pelvic floor may be tense and overactive, and that can contribute to pain as well. So I always kind of caution folks that there could be weakness, there could be tension, but you really want to kind of see what your symptoms are aligning with. If you're having pain, if you're having painful intercourse, tailbone pain, that could be more aligned with the tension issue of the pelvic floor versus a weakness issue. I would say we commonly see urinary leakage, pelvic organ prolapse, which is when those muscles aren't as supportive to the pelvic organs and they start to kind of droop into the vagina. You can feel like you have a bulge or something falling out. I think another really common one is painful sex. We think a lot about someone being like, having weakness postpartum, but pain with sex is really common. 9 out of 10 women have it the first time they have pain with sex after giving birth. Some of it can be due to vaginal dryness from lactation or hormonal changes. So I always recommend using a lubricant and kind of a moisturizer on the area, which there are specific ones for the vulva. I also teach folks how to do scar massage after their scar has healed on the perineal scar. I think it's like 93% of women tear during a vaginal birth. So like scar tissue does not soften and move the same way that pre-tear tissue does. So just doing a little bit of gentle perineal massage to the area at the opening, and even working on a C-section scar, that can really help improve bladder emptying, bowel emptying, painful sex, things like that. So I'm a really big fan of a lot of manual therapy to this area. And then we work towards doing a lot of deep core and pelvic floor strengthening. So kind of strengthening those deep transverse abdominal muscles, pulling in the pelvic floor. And this doesn't look like just doing Kegels while you sit in a chair. I mean, you can start with that, but it's really thinking about engaging these muscles with movement, with function, like before you pick up your baby, lifting the stroller into the car, contracting before a cough or sneeze to help prevent leakage. And then into exercises like bridges and squats and lunges, like teaching this muscle how to fire after it's been kind of exhausted for many months. And then also strengthening it over time, just like you would strengthen a bicep, doing muscles and kind of bringing it into a workout. So it doesn't feel like, oh, I just have to do Kegels. And we don't leak when we're sitting in a chair. It's usually when we're running or moving so you want to use those muscles in an upright position and with function.
Yeah. Again, I'm like, my head is going and making a checklist of all the things I get to integrate and speak to my patients about. So thank you. You're right. There's this, there are all these kind of symptoms postpartum that come up so commonly. And some of them are expected and some of them can be surprising. And I really do like the idea of scar massage. I think from one of my prior guests who was a pelvic physical therapist, it was the first time I learned about C-section scar massage. Again, I think I'm pretty smart. I went to some of the best training institutions in the US, but like they don't teach us these things in our training, right? And so I really love the idea of like imagining kind of massaging the C-section scar. And now I literally tell all my C-section patients to do it and I show them how to do it. But yeah, perineal massage as well makes a lot of sense. Is there like any technique that you recommend? Is it internal? Is it external, like at the perineum, or internal at the introitus?
Yeah. So I, for the perineal massage, so typically the tear happens like at the base or the side of the vaginal opening. Sometimes it can go into the rectal area. So I do tell folks to make sure the scar is completely healed. There's no granulation tissue. All the sutures are healed. There's no bleeding. That can typically take between 6 to 8 weeks. And then you've obviously been cleared by your medical provider. But I actually tell them to take a little bit of oil or lubricant, and you can sit on the toilet or the edge of the tub and kind of insert your thumb into the vaginal opening. And think of your vaginal opening like a clock. The very bottom is 6 o'clock. So you kind of want to go to the sides, like 7 o'clock or 5 o'clock, and just apply a firm pressure with your thumb. And that can just help stretch and soften that tissue. And it's going to feel a little bit burny, but you just take some big, deep, soft breaths and you'll feel like that muscle or that tissue just kind of melts after a little bit. And then after that, you switch to the other side, do the same thing. It's not a really aggressive swiping. It's kind of like a pressure point massage like we do in the knots in our shoulder. Like you apply pressure. It feels like almost so tender. It hurts, but feels good. And then you take some big, deep breaths and that just helps soften those muscles and tissues. And you can do that every other day. It takes 3 to 5 minutes. And then you can, once it starts becoming less uncomfortable, then you're like, okay, I don't think I need it as much. But it's one of those things that you're softening that scar tissue when it's remodeling. You're also desensitizing the tissues. I think if we have pain in an area, we tend to want to just like avoid touching it. And that's really hard to kind of bridge the gap between not wanting to go, have anything near there to having sexual activity. So it really helps just kind of bridge that gap. And then also help just bring a lot of blood flow and relaxation to the muscles and tissues. So, and there's no negative side effects. I mean, it's really just a way to kind of connect with your body and feel like you can do something to help with healing as well.
Yeah. Something else that comes up a lot besides the pelvic floor changes is diastasis recti. Like diastasis recti is everyone's like, hot topic, sometimes we're talking about it in pregnancy, but most often postpartum. Can you explain for listeners what that is and kind of what your approach is to deal with that postpartum?
Absolutely. So diastasis recti is when the midline of the abdominal wall, so you've got your six-pack muscles. I've never seen mine, but they're supposed to be there.
Apparently they're there.
I know, apparently they're there. And in the middle, there's a line of tissue called the linea alba. And during pregnancy, that line of tissue gets really stretched out, which makes total sense because you have a growing baby in your belly. But what happens when that thin line of tissue gets stretched out is it becomes really thin and it doesn't manage your pressure as well. So it can look like when you do a crunch up, there's like a little football or like dome in the middle of your belly. Or even after birth, it feels like your belly still looks pregnant when you're not anymore. We used to call it mummy tummy or, a mom pooch when it's just those abs have not been kind of gone back down because that midline is really thinned out and stretched out. I really am a huge fan of what's called compression. So I don't like waist trainers, which kind of reminds me of like this tight bandage that you wrap around the waist. I like something that's a little more like a sports bra for your pelvis and your belly. And it's, my favorite brand is called Love Steady. It's a pair of bloomers and they look like tall, long underwear that kind of go underneath your pelvic girdle, but go over your belly. And it just kind of hugs you in and gives you a little bit of extra support. Yeah. So I tell moms to start wearing them right after postpartum. You can put your postpartum undies in there. You can put pads, but it just gives your belly a little hug. Yeah. And it's not like squeezing everything at your waist and pushing it towards your pelvic floor. It's kind of giving you a hug from the bottom up. And then you can start working on deep abdominal wall contraction. So this is a little bit tricky to explain, but it's like your transverse abs are like the deepest layer of your muscles in your abs. They are underneath your rectus and they fire when you actually do a pelvic floor contraction. So when you do a Kegel contraction, your low abs kind of fire with that. So starting with that pelvic floor deep ab contraction, get those muscles firing. And then again, you build them into exercises like bridges or single leg marches or planks and push-ups. You have to fire those muscles to get better tension at the midline of your core. And so that's going to help kind of strengthen that midline of the core, those deep ab muscles, and then also avoiding movements that could exacerbate that diastasis. So like crunches or crunching up out of bed or maybe even leaning back really far, throwing something in the back seat to your kid and you see that bulge come out. Avoid those movements that cause that bulge and then integrate that deep core contraction into workout.
Yeah. Yeah. That comes up a lot where patients will ask me like, okay, crunches, when can I do crunches? Are they bad or not? And there's times where I'm like, in the past where I don't have the answer. I fortunately have the answer now, but is there a time where someone can get crunches back into their core routine?
Absolutely. So I always tell folks to kind of start with the basics and it feels really slow at first. I think the hardest times is we want to get better really fast. We've kind of feel like we haven't owned our body in many, many months. And after birth, we just want to reconnect with ourselves physically and even kind of more spiritually and emotionally. Yeah. So it feels slow. But I tell people like take those first 12 weeks. They can be the first 12 after birth. They can be months later, but really focus on rebuilding your core. And that means like these small, subtle pelvic floor contractions, deep abdominal wall contractions before you progress to doing something kind of higher intensity. So with a crunch, I would say like lie on your back, do a deep core pelvic floor contraction and just do a single leg lift. And then just do a double leg lift with knees bent and kind of just seeing like, do I have that doming or coning in my midline when I do those things? And then do a little crunch up. Do I have the doming or coning in my abs when I pre-contract? So you always have to pre-contract and then do the movement. So if you pre-contract and do a crunch and there's no doming or coning, crunches are fine. Yeah. But if you do a crunch and you have the doming or coning, even when you contract your abs, then I would probably say it's too much for you and you need to rebuild your strength until that coning doesn't appear. Yeah. Or it may be like you can maybe do 5 crunches without the doming or coning, but then when you do 6 or 7, it happens. And that means, my muscles just can't quite handle that much load. So you always stay a little bit under the threshold of where you are. Nothing is so black or white, like you can't do it or you can do it. It's really like how you do it and how much of it can I do before my tissues start to wear out.
Yeah, no, I appreciate that. And something that you and I probably see so much is there's this, and I think you hinted to it, there's this strong pressure to go back to you pre-baby, which I think that like part of that is the fault of society, social media, and that stigma that we create around like how we look postpartum versus how we looked prior to baby, and how quickly can we get back to that version of that person. And I, as an OB, I have a lot of feels about that, and that I think so much of respecting that like massive transformation of matrescence is respecting the fact that you are evolving, you are changing, and there is a new version of you to love. And even though we spent the past almost hour talking about the pelvic floor changes and how to address them, also recognizing that, you know, that six pack that you and I've never actually seen, and maybe doesn't even really exist, we won't necessarily get to see that six pack postpartum. I mentioned that, just ask, how do you approach, as someone who is an expert in this space, who's giving a lot of excellent advice about how to improve diastasis recti and pelvic floor weakness and incontinence, et cetera. How do you address like kind of this tricky concept of, you know, bouncing back and the before, and we've all seen it on social media, the before and after pictures. What's your approach to balance that?
You know, I think it's tricky. I think it's really important to meet moms where they are. And when they say like, I really want to do this, I'm like, okay, it's not that you can't do this. You can totally do this eventually. But I always kind of just make an analogy of like, we need to build the foundation of your house before we try to put up walls and fancy light fixtures. Like, we need your core and pelvic floor have been exhausted, you know, worked to the max. As your sister says, like, they have been a workhorse for many months, and we can't expect them to go back to exactly where they were when we haven't worked on those things. Mm-hmm. And so I always say, like, take those 12 weeks. My patients who take the first 12 weeks to really rebuild their core and pelvic floor, take it easy. Don't push themselves too hard. Just do some walking and core work and strengthening. They do so much better in the long run. Like, then you'll be able to run, and then you'll be able to lift weights. Then you'll be able to go back to the things you love to do with less dysfunction or without dysfunction than my moms who are back in the CrossFit gym at day 11 after giving birth. So I really just try to be like, think of the long-term you instead of like the short-term you, which is hard. The other thing is, I say, like, one, you're not alone, but two, this is absolutely not your fault. You are entering back into a society that is expecting you to function at full capacity when your body is not there. Like, we're not supporting moms and giving them the time off of work, the paid parental leave, the healthcare, the childcare. So if we nurtured the mom more in that period, I actually think that moms would nurture themselves more. But we have this outstanding pressure to function like we're at full capacity. So we want to get back to that, whether it's aesthetically or physically, but we're not there, but we don't have that support. And so I think that if we really kind of gave moms what they needed and the time and the care and support, I think we would, as moms, feel like, okay, I have a longer runway to heal and recover than feeling like I have to get back to where I was, because that's pretty much what society's asking me to function at, to where I was, but I'm not there. And so I think it's a kind of larger societal issue than just like the pressure we feel.
Yes. Oh my gosh. Are we like, you're in my head? No, but it's true. I think that, you know, I've spent a lot of time pondering kind of my own like stress points around postpartum care, my own frustrations with the way that we support moms through pregnancy and postpartum, recognizing that our large healthcare system, it's trying its best, but it's fractured and it's strained. And I think that the healthcare system, as it currently is, the policies that are set to support the system don't recognize, going back to my favorite term, matrescence, don't recognize that postpartum doesn't end at 6 weeks, and it honestly doesn't end at a year. It probably is a new state that lasts for a very, very long time, that is beyond just the physicality, the physical changes, it's hormonal shifts, it's identity shifts, it's relationship shifts, you know, how you see yourself in relation to your partner, your coworkers, your friends. And it requires time. The societies, the countries that I think tend to do it best, and I know no place is perfect, to me are the ones that recognize the importance of parental leave. So my favorite example is my good friends who have had kids in Germany and Finland, and they had at least a year off of parental leave, like recognizing that in that space, when you're not worried about going back to work at 6 weeks, or I guess with a C-section, 8 weeks, which is still not sufficient amount of time. If you know you have at least a year with your kiddo, can you imagine? I mean, I just like literally have this vision of just like shoulders going down, the amount of like, just like the relaxation that you physically and emotionally feel when you're like, I've got time. I've got time to figure out breastfeeding. I've got time to figure out my body. I've got time to figure out my new relationship with my partner, like, you know, versus this like pressure of like, oh, I've got to get back to work in 6 weeks or 8 weeks. If you're lucky, some people can get off for 3 months, but that's still not enough time. And so I think so much of what I appreciate having conversations like with people like you who are so passionate about women's health, who recognize that our society has room to grow, and recognizing that there is better ways that we can support birthers and their families. And a lot of it is recognizing not only the physical demands on the body. And I love that a pelvic PT is telling me that, yeah, like this physical stuff that I work with my clients on, but like, no, it's society. I'm like, yes, girl, yes.
Society.
Right? Yeah, but it's so important to just recognize that you have this niche and you have this beautiful way of making people feel good about their bodies again. But I love that you also appreciate that urgency that people often feel to like go back to work or look a certain way comes from all these external societal pressures. And so I think that you are so fortunate that you have this beautiful, amazing platform through VHive and now your book Forward to continue to push this conversation forward. And I hope my baby little podcast is doing its own part, because I think that more and more people need to talk about matrescence, about postpartum, and give the postpartum period the respect. Like I'm thinking REST, or Aretha Franklin style, the respect that it deserves, because it really at this point, I don't think that our society currently as it stands really truly respects and appreciates the full breadth that is postpartum on that birther and their family.
Absolutely. And, I think it's really this, you can kind of, I get on these tangents about the big problems of the world, and women's healthcare. But I think, having been in this field for 18 years, like you can't have person after person, woman after woman come into your clinic and you hear these stories and I can't think like, oh, this is just the way that it has to be. I'm like, there has got to be a better way. Like women deserve better care. Moms deserve better care. Like we can't keep doing the same thing and expecting to get better. So it's even if it's, one pelvic floor that's changed or one hospital that changes their system or one workplace that gives better, postpartum support, whatever it is, it's like we just have to like keep just moving the needle just a little bit, because we are so far from the support that women and moms need. And I think that, everything that I've created, the VHive, the book, it's really out, in response to what people ask. It's not like I had this master plan of like, I'm going to write a book. I'm going to start an Instagram. I'm going to start a program. People will just say like, hey, do you have this? Or this would really be great. Or what do you think about this? And it's just responding to the need of what people are asking for, and having the privilege to be able to take the time to do these things and the passion to want to make this kind of care more accessible to people. So it's really, I think for folks out there and for the ones that I've seen that have trusted me with their care, who all said like, why didn't I know this sooner? And I just really want that to change.
Yeah. I think I appreciate that you recognize your privilege, but you're using your privilege with purpose and passion, right? That I think that this podcast is my own personal effort of doing the same, of really caring for the communities that we have the absolute honor of serving, and recognizing there's so many different ways that we can outreach. Speaking of all the cool things that you do, I'd love to take a moment to highlight. So tell us more about the VHive, tell us more about the book and all the other exciting things that you're doing right now.
Thank you. So I'm on social media as the Vagina Whisperer. On Instagram, I'm the.vagina.whisperer. I'm on TikTok as the Vag Whisperer, because TikTok doesn't like the word vagina.
Wow, TikTok.
Right. I know. But the VHive is a platform we're creating an app out of it that gives folks online pelvic floor fitness and workouts at home. I think working with all of my patients over the years, one of the hardest parts was to get them to do their home workouts, and also responding to folks who say like, I don't have a pelvic floor therapist near me, or I can't leave work, or I don't have childcare coverage. So how can they get the education and information they need? So I kind of started building out these programs that offer everything from like postpartum to childbirth prep to perimenopause to painful sex, and just really hitting, I think, a lot of the different kind of symptoms and aspects that folks need support with. And the workouts are 10 to 20 minutes. They're not super intense. I'm not like a really intense fitness person, and I'm also a busy working mom. So I think like, I have 10 minutes. I can do this. And my mom, who's in her 70s, who can do this. And, my cousins who are in their 20s can do this. So really thinking about what do we have time to consume. So it's all home workout videos and education. And then my book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, is coming out on June 10th. And everyone who pre-orders gets 30 days free to my VHive fitness platform. So if you pre-order, you can get access to all of that to check it out. I mean, I want it to be available to folks and kind of them to say, like, what does a pelvic floor workout look like? And even just feel a little disarmed going into a pelvic floor therapy session, or feel like demystified about this part of our body that we don't talk a lot about. But the book really covers, like, through every life stage, how does your pelvic floor change? What can you do to prevent issues? And then if you are experiencing issues, what you can start doing right now, whether it's from pregnancy and childbirth and postpartum to painful sex, perimenopause and menopause, to when you get your period. So just really kind of walking through every life stage of being a woman and offering some guidance and support for your pelvic floor throughout those stages.
Yeah. Well, I'm so glad that someone like you exists. I'm glad that you've taken your knowledge and your passion to create resources like VHive, and books like Floored. As I already alluded to, one of the unexpected but pleasant surprises of starting the podcast is connecting with people like you. I find myself, one, inspired, but two, hopeful that there's times where I feel so overwhelmed by how many things that we need to do to improve care for women's health, and recognizing the reason why I feel overwhelmed is somehow I think mistakenly I need to do it all. But there's someone like you who is doing it within your expertise and doing it so eloquently. I already know that I will recommend your book and the VHive as a resource for patients, because we talked already about the patients who have a privilege of getting referrals to providers, but not everyone is able to do that. And so anything that increases ease and access is great. I love that your examples of, like, who you think about as your 70-year-old mom and your 20-year-old cousins, right? I think oftentimes, at least for myself, I've been inspired by the women in my life, whether it's my mom, my sister, my girlfriends. And so really thinking about creating something for the people that we love the most, and knowing that if you make something with those people in mind, a lot of other people likely benefit. So thank you for doing what you're doing. As we kind of wrap things up, we spent so much time thinking about kind of how you support your clients and how we as OB providers or midwives, if they're listening, can help support their patients. But how was your personal pregnancy experiences? I know you mentioned to me that I think you have 2 kiddos, both of which who might be getting home during this recording. So thank you to them for not barging into the room at this point. But what were some of the kind of the pelvic floor changes that you may or may not have experienced in your pregnancy, and how prepared did you feel as someone who, this is your field, this is your jam? Did you feel like you went into your pregnancies and postpartum more empowered than most?
In full transparency, I did. I actually went to see my colleague, my pelvic floor therapist, during my pregnancies. I had already been practicing for 10 years, and I had no idea how exhausted I would be. 2, I was like, I've been way over prescribing exercises for all of my patients. Like, there's no way I'm doing 30 minutes of this stuff, So I'm like, 5 to 10 max. So I changed the way that I kind of approach, pregnant patients. And I realized how physically taxing it was, how just that pregnancy experience. But I did a lot of childbirth preparation. I did have a doula for my birth, and I did have unmedicated birth. And it wasn't because I was like, I feel this way. I'm just kind of like a less is more person. And for me, like, being at home as long as possible. We didn't tell any family members we were I was even in labor. I was just like, I kind of had to put my head down and be like, okay, I'm just going to do this as long as I can. And then we'll go to the hospital when I need to. Yeah. My first child, I arrived there 3 minutes before he was born. So I waited a little too long. And my second one, my second one, I arrived 20 minutes before he was born. So I had I know it was, it's just a little exciting. I'm always late. So this kind of this checks out. But
it tracks.
I did have really good births, and I had really good postpartum recoveries. And I think that 1, some of this has to do with luck and genetics. But 2, I also felt like, wow, I kind of want everybody to know this is possible. I feel like sometimes we hear these really difficult, traumatic birth stories. And I was like, I feel like if more people knew that this could happen, it's not always going to happen, but if there was a chance, this is possible. And it made my postpartum recovery just a lot easier from a physical perspective. There were other challenges, relationship, breastfeeding, emotional, things like that. But from a physical perspective, I felt really good. And so that kind of really helped inspire me to okay, women need this. To your point, I was like, why did I pick this field where I just got to have all of this information about my pelvic floor and vagina. Like everybody deserves this information. And what they choose to do with it is up to them, but it really should be the standard of care for women to be educated about their bodies instead of learning about it after something happens. So I did have great birth, but motherhood, everything after that has just kind of been a shit show. So
Yeah. Yeah.
the birth was fine. Everything in the past 10 years after that just been a guessing game.
Yeah. And as it's supposed to be. I mean, I think, again, we could literally talk for another couple hours just on like motherhood and newborn care and all the other stuff. But no, I think that that's so, I mean, two things I heard that are so lovely is one, you recognizing that, wow, those 30-minute exercises aren't really reasonable. Let me change my expectations for my clients that 10, 20 minutes is something that someone can more feasibly do. And yeah, that humility that you gain when you actually are in it yourself. But two, as an OB, I would say that both of your births sound remarkably, amazingly smooth. And I'm so grateful for you. Showing up with your first baby within 3 minutes of delivery is impressive, and also speaks to your own personal and mental, physical strength, but also just reflecting that, like, yes, you had your own birth that went relatively smooth. You felt empowered, you got doula support, and just giving women that kind of hope that potentially they can achieve it, knowing that there's so much that we can't control, but they potentially can achieve it, and not being so scared or demystified by a lot of the kind of more negative birth stories that are out there. It's nice to sprinkle in, the happy, joyful stories amongst, sadly, the sad and more traumatic ones that can occur too. All of them exist, and I think that's probably the thing I'm most inspired about working in this field. Is we've talked about kind of that spectrum of pelvic women's health from, so much of our conversation focused on pregnancy and postpartum, but as you already alluded to it, that first period, wearing a tampon all the way through the point where your periods go away, and perimenopause and menopause. I don't know about you, Sarah, but that's why I love our field. Like, I love the fact that there's this full trajectory, this full spectrum of the ways that we can show up to support our patients and help them feel safe and understand those physical changes. And so really understanding that even within a birth story, there's a full spectrum in terms of like women's health and our reproductive health and our pelvic floor health. There's a full spectrum. And it's so cool, lack of a better word. It's so cool to be able to show up for women in that way. They deserve people like you who are passionate, who really want to increase their exposure and understanding of themselves. And as we wrap things up, you've given a lot of incredible advice so far, so much that, again, I'm taking home to share with my patients. And so I'm saying thank you on behalf of them as well. But any last words of advice that you'd like to give to any mom who is listening right now, or moms to be?
I think that, one, I want to thank you as well. I mean, I think just being able to have these conversations and you sharing this with your community is so rewarding and inspiring. And I'm just amazed at the work that you're doing and continue to do. And I feel that passion from you as well. So thank you so much for the opportunity to speak with you and get to learn more about the amazing work that you're doing. And I think for moms, I always just, one of the biggest things, I actually went to a kind of a women's conference this past weekend in Brooklyn at a space called The Soft Space by a woman who goes by Mama Glow. And I was so inspired by the women in there. It was more focused on perimenopause and menopause and intimacy. But what I loved about this was, like, your story doesn't end. Like, this one stage does not define you. This is literally like a turn of a page. And yes, it can affect you. It can influence you. It can inspire you. It can change you. But our stories don't end. And to see women continually wanting to advocate and learn about their bodies at any stage. I mean, some of these women are 40s, 50s, 60s, 70s. And I was like, this is a journey, and it doesn't, things will happen. Speed bumps can occur, all these tips and things I can give you. But I think it's really looking at, like, this is a process, and the process is changing, and what we know is changing, and how we are treated is changing. And we always want to move that forward. But if you don't get the care that you feel like you need or deserve or warrant, like, don't let that be the end of your story. Like, you can keep moving forward and seeking the people that can help you, or learning what's normal and not, and advocating. But it's just, I think that was the biggest thing, was like, it's just a long journey, and we have a long runway ahead. And just don't let something that positive or negative has happened be the end of your story. Use it in some way, take it with you, but always just, kind of know that there's more ahead in a really positive way.
Yeah. Ugh, so beautiful. No, I'm imagining the book of life that we're all writing, right? From the moment that we entered the world, page one was written with a forward that was created from the people that made us, and that every page, every chapter is adding to our book. And sometimes you can feel like the book is over, but it's not. And recognizing that the physical changes or emotional changes, mental changes that we experience as women can feel sometimes so jolting, but it's there's a concept of evolution. And I think someone prior guests taught this to me, and I love it. It's like understanding, no, we're just evolving. We're constantly evolving in versions of ourselves. And for me, as someone who has a tendency to self-doubt and have a little bit of self-loathing and a little bit of imposter syndrome and all those, beautifully negative voices in one's head, it's really, really encompasses this idea of like self-love and self-acceptance when you think about your evolving self. And I can apply that to all the patients I care for, whether it's like the evolving teen who's like, what's this period thing? This sucks. Or the very menopausal woman who's like, oh my God, my periods are going away, but what are hot flashes? This sucks, right? We're evolving, and it's not to minimize each transition as not being jolting and hard. I mean, we talked a lot about that matrescence transition as well, but like, okay, this is the evolving you. How can we meet you where you are? How can we make you feel safe, seen, inspired, all that beautiful terminology to help you make that transition as best as possible. I'm so glad there are people like you out there doing it in your own way. Beehive and Ford are going to be such amazing resources for those who've already accessed them, or those who are going to pre-order the book in the weeks to come. So knowing how busy you are with all your amazing projects and all the hats that you wear, thank you again for making the time for me and this podcast. It's been such an honor.
Thanks for having me.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.